What if I told you that Botox, yes, the same injection people use for wrinkles, might help men who've tried everything for erectile dysfunction and still aren't getting results? I'm Dr. Reena Malik, urologist and pelvic surgeon. And I know that sounds kind of crazy, but here's the thing. Brand new research over the last few years have shown us some pretty eye-opening data that challenges what we thought we knew about the treatment for guys who have difficult to treat erectile dysfunction. Now, I want to be clear. This is not FDA approved. It's not in the guidelines, but the science is compelling enough that I think you need to know about it. So today we're going to break down exactly how Botox works for erectile dysfunction, dive into the actual numbers from multiple clinical trials, and I'll tell you who might actually benefit from this approach. So first things first, how could Botox possibly help with erectile dysfunction? Well, to understand this, we need a quick anatomy lesson. If you've been following me for some time, you might have heard the mnemonic point and shoot. Point refers to getting an erection, right? Which is controlled by your parasympathetic nervous system, P. Shoot is your ejaculation, which is triggered by your sympathetic nervous system. So Botox works by blocking the sympathetic nervous system. Specifically, it prevents the release of norepinephrine, a neurotransmitter that keeps things tense, including the smooth muscle of the penis. Think of it this way. Your sympathetic nervous system is like your body's stress response. You are running from a tiger or running from a stressor. What happens is your body is not thinking about getting an erection, right? It is thinking about running from the stressor. And your sympathetic nervous system is not only triggered by obvious stressors, but it's also triggered by health conditions, things like high blood pressure, diabetes, or heart disease. And this actually prevents the smooth muscle in the penis from relaxing, which is the most important part of getting an erection. Your smooth muscle has to relax so blood can flow into that smooth muscle, allowing it to get firm and hard. And when you can't do that, you basically can't get an erection. So Botox essentially tells that overactive sympathetic nervous system to calm down, which allows blood vessels and smooth muscles to relax. And the result is you get better blood flow where you need it. You can also think of it like a paralytic, right? When we use it for wrinkles on our face, it basically paralyzes those muscles. So when you put it into the smooth muscle of the penis, it is paralyzing those muscles to some extent. It is relaxing them so that blood can flow in more easily. Now, the most common cause of erectile dysfunction is vascular, meaning there's either not enough blood flowing in or too much blood flow leaving before you're ready for it to leave. And that's exactly the problem Botox seems to help with. But does it actually work in real patients? Let's look at the data. So the earliest studies were very small, but they were pretty well designed randomized controlled trials, meaning they compared patients who got Botox to those who didn't but got a fake injection. And that's essentially the gold standard of medical research. The first randomized control study was done with 24 patients. Half received Botox injections directly into the erectile tissue, and the other half got a saline injection. And these were men who had already failed oral medications, like they weren't getting strong erections with Viagra or Cialis, or basically sildenafil or tadalafil. And they'd even tried intracavernosal penile injections, and those didn't work either. At the 4-week mark, the men who received Botox showed significant improvements in both erectile hardness and overall erectile function. Basically, these guys who were not responding to anything at all, some of whom were deciding to go ahead and get penile implants, were now able to get firmer erections. But researchers also want to know, does the dose matter? So they looked at a larger trial with 176 patients, and they tested 50 units of Botox versus 100 units. And here's what they found. Both doses worked well and achieved the improvement in erectile function at 3 months after the injection. So they followed them out for 3 months. They reported meaningful improvements in the International Index of Erectile Function questionnaire, which is essentially the questionnaire we use in research to identify if you're improving on sexual function. However, at 6 months, the 50-unit group started to decline back towards baseline, while the 100-unit group still maintained their improvements. So this tells us something pretty important. Like Botox for other conditions, the effects wear off over time. But when you get a higher dose, it seems to last longer. And the average duration before men needed a repeat injection was about 9 months, which is similar to what I see when I give Botox for overactive bladder. It can be anywhere from 6 to 9 months. Now, the most rigorous study was a double-blind, placebo-controlled trial published in 2024, meaning the patients didn't know and the doctors didn't know what they were getting. So this included 70 men with erectile dysfunction that they didn't respond to pills, and they measured everything. They measured the erectile hardness score, blood flow using ultrasound, validated sexual function questionnaires. And 2 weeks after the injection, the Botox group showed significant improvements compared to placebo. Their sexual health inventory for men score, again, a score about sexual function, improved by an average of 5 points. And 53% of the men in the Botox group could achieve erections firm enough for penetration compared to only 3% in the placebo group. And these improvements lasted about 12 weeks. Now, one caveat, this is still in abstract form. I'm still waiting for the formal publication, but I know the group who did it. It's a very good study, and it was very well done. All of that is really, really promising. However, a 2025 multi-center trial just published their findings, and their overall results didn't show a significant benefit when adding Botulinum Toxin A, or brand name Xeomin, to guys taking Viagra. However, when they looked at guys who were compliant and always took Viagra with the addition of the Botox injection, those guys did see a significant improvement with the addition of Botox. So there's probably some synergy that you need both. So most of these studies are sort of in very strict controlled research environments, but sometimes you can get studies where they look at the real world. So how this is dosed out in the real world in real clinicians. So they did a real world study in 2023 that looked at 216 men who received Botox for erectile dysfunction. Of those, 92, about 43%, came back for a second injection, which tells us they found it helpful enough to repeat. And on average, they waited about 9 months to get their next injection. Now, this is actually interesting because in my practice, after I saw this initial data, I started offering Botox to patients who really wanted it, knowing that this is completely experimental and that we don't know that this is really going to be significantly beneficial in all patients. And there's a risk that it may just be a waste of money because right now it's not covered by insurance. And in my patient population, which is not reflective of the real world, I would say most of my patients, over 90%, have come back for a second injection, and some have come back for third or fourth injections. So when you look at severity, you can look at mild ED, moderate ED, or severe ED, and how many of them saw an improvement. So when they looked at the guys who had mild erectile dysfunction to start, 90% saw a significant improvement in erectile function. And significant is different based on how bad the ED is to start with. So they'll use validated questionnaires to say, okay, if you have mild ED, 2-point improvement is an improvement, whereas moderate ED, 5 points is a significant improvement. And this is based on lots of data that has looked at what patients determine as significantly different or a significant improvement. So for moderate ED, about 50 to 55% of men responded. And for severe ED, the response dropped to 33%. But these guys, remember, are guys who failed multiple other treatments like pills, injections, and they're just really at their last point before having surgery. But they also looked at the guys who had severe ED who combined both Botox and oral medications, or even penile injections like intracavernosal injections, and that response rate jumped up to about 50 to 60%. So again, combination therapy seems to work better. And also, it showed us that there were certain groups that are less likely to respond. So men who've had prostate cancer surgery or spinal cord injury, where this is more of a neurologic cause for sexual dysfunction, they didn't see a benefit. Another study was a systematic review and a meta-analysis, which looked at multiple studies, basically looking at all this data, found that 77.5% of men who received multiple injections, meaning they came back a second time, saw a significant improvement. And they even looked at the different formulations of Botox, Dysport, Xeomin, those are all brand names, and they didn't see a significant difference between any of the brands. They all worked about the same. Now, the important question here is this safe? Now, the good news is that all of these studies, the safety profile is very high. The most common side effect, and really the only significant one, was pain at the injection site. So what happens when you come in for this procedure, at least in my office, is we numb the penis with some numbing cream, and then we do 4 injections into the penis itself. And basically, I would say even with the numbing, people do still feel a little bit of pain when the Botox is injected, but it's very short, it's very quick, and it's very temporary. The most inconvenient part of it is that we usually place a constriction band at the base of the penis during the injection and for 20 minutes after. And this is so that we prevent any Botox from getting systemically absorbed into the body. And again, I've never heard of that happening. There's never been a reported issue. So we do it out of abundance of caution. And anyone having prolonged pain after injection is exceedingly rare. Now, the one feared complication is a priapism, and a priapism is an erection that lasts longer than 4 hours without stimulation and is painful. And this is a serious problem. A lot of guys will be like, oh my God, that would be great. It's not great. It's not great because now there's no blood flow moving in or out of the penis. And after about 4 hours, the penis starts changing. It starts saying, hey, there's no blood flow here, so I'm going to start scarring down. And that can be a permanent problem. So if you are ever in the situation where you have a prolonged erection, please get to the emergency room right away. Now, the reason we worry about this with Botox is it's relaxing those muscles, right? And they need to contract to get the blood flow to leave the penis. There was only one reported case so far, one case across hundreds of patients, no other serious complications, no permanent side effects, no systemic issues. And this is really important because when you think about treatments, you want to talk about, again, think about the benefits and the risks. Again, I want to reiterate, this is not FDA approved. It is not in the American Urological Association guidelines. It is not covered by insurance. And most of this research has been conducted in Europe and France, and it's still considered experimental in the United States. Of course, these studies are not perfect. Most of these patients were followed for about 6 weeks to 7 months, so we don't have great long-term data yet. However, we do know that Botox wears off, so likely there's not much more to it. These are all small studies. The largest had about 176 patients, and we need more clarity on what is the optimal dosing, the best injection technique, what's the best candidate, and what can we expect long-term, 5 years. Are people still going to be seeing a benefit with Botox if we continue to inject it? So based on what we know, who do I think is a good candidate? Well, if you've tried and failed oral medications like Viagra and Cialis, maybe you've even tried intracavernosal injections and those didn't work, you need to have vascular erectile dysfunction. So it has to be a blood flow issue, not a nerve issue from surgery or injury. And it may be something to consider before you go ahead and have a penile implant. And you need to remember, this is not a one and done thing. You will need repeat treatments if you want to maintain the effect about every 6 to 9 months. The other thing I didn't mention is some studies also looked at stretched penile length. And what they found was that because Botox relaxes the smooth muscle of the penis, they saw an increase in length of the flaccid penis. So it looked more long because the muscles were more relaxed. So that may be an added benefit. However, I don't really market that as a definite way to increase penile length because we just have very little data. Bottom line, Botox for erectile dysfunction is showing promise in clinical trials. Response rates range from 40 to 77%, depending on how severe your ED is to start and if you combine it with other treatments. And the science makes sense. It helps relax smooth muscles to improve blood flow and block the overactive stress response from your sympathetic nervous system. It seems very safe with minimal side effects. However, again, it's experimental, not ready for prime time yet, and most urologists in the US are not offering it. But if you've tried everything and you're considering a penile implant, this may be worth discussing with your urologist as a potential bridge option or as part of a clinical trial, which if you can access a clinical trial, that is always the best. I have one plea for you guys. If you are not subscribed yet to the channel, I see it on the back end. So many people watch my videos, but only about 20% of you actually subscribe. So do me a favor. If you enjoyed this video, if you've watched one other video and you've liked it, make sure to subscribe. It is free. It's zero cost, a great way to support the channel and a great way to tell YouTube, hey, I like this creator. I want to see more of her content. I want other people to see it as well. Because what we do here is we try to educate people so they have the information they need to improve their sexual health, have the questions they need when they see their doctors, and they feel better about themselves. So as always, remember, take care of yourself because you're worth it.